Hi, everyone. Welcome to Reclaim, a podcast where we explore the inner lives of tender-hearted people, diving deep into issues like self-worth, trauma, and relational difficulties, all through a depth-oriented or psychoanalytic lens. This is the place for you when self-help doesn't help, and I am your host, Thais Sky. Today, I am so thrilled to be joined by Dr. Michelle Harwell. She's a psychoanalyst whose work I deeply admire. Michelle Harwell is a training and supervising analyst, a respected instructor, and a practicing clinician with specialization in trauma, development, and contemporary relational psychoanalysis. For over a decade, Dr. Harwell has trained and supervised clinicians through a unique integration of psychoanalytic principles and the humanities, always holding a reverence for theory alongside with a deep humility for the complexity of the human story. She has published numerous papers with writing interests focused on the interior process of the analyst. She's especially noted for her expertise in early and relational trauma, adoption, and neuroscience, and for her ability to make even the most complex topics accessible, often with clarity and humor. Beyond the consulting room, Michelle is also a certified yoga instructor, bringing a deep awareness of the body as the first speaker of life's experiences, whether joy, stress, or trauma. She maintains a robust clinical practice working with adults, children, families, and couples. Her academic journey is equally impressive. A doctorate in psychoanalysis from the Institute of Contemporary Psychoanalysis in Los Angeles, a BA in English Literature from the University of Oklahoma, an MA in Theology from Fuller Theological Seminary, as well as an MS in Marriage and Family Therapy from the Fuller Graduate School of Psychology. So in our conversation today, Michelle and I explored the lived process of psychoanalysis, from the meaning of silence in the consulting room to the role of frustration and rupture in deepening the work, to how psychoanalysis offers us not tools and fixes, but a way of living with greater agency and sturdiness of mind. We also talk about Michelle's inspiring vision for the Alamo, a new community space that she's creating for psychoanalysis in Los Angeles. It's a really beautiful conversation. I'm so grateful to have had Michelle on the podcast, and I can't wait for you to hear this dialogue. So with that, let's dive in. Hi, Michelle. It's so nice to connect with you. I'm so thrilled that you said yes to being on my podcast. Thanks so much for being here.
Yeah, thanks to me. I love the project you're endeavoring and anyone who's interested in bringing psychoanalysis to a wider audience. So,
Yeah, I remember you were one of the first presenters that taught my cohort at Airport Marina. At least that's my memory of it. And I remember experiencing you as so kind of fresh and dynamic. And up to that point, I have been experiencing psychoanalysis is very daunting and intimidating and overwhelming, and a world that I was never going to really be able to be a part of. And having you come and your presentation kind of gave me a sense of like, okay, maybe this is something I could grasp, I could wrap my mind around. Maybe it's not just for the olds. Like maybe there's space in this field for me too. And so I really appreciate the impact that you had on me.
well, that is the biggest compliment, I think. And as I talk more about my philosophy, I think that psychoanalysis is so intertwined with the person and our humanity, and I think it has a kind of lofty history of theory that I think weighs down and intimidates and creates a lot of barriers. So,
That's right. That's
yeah.
right. Yeah, it does do that. And, so I've been hosting my podcast since before I went to grad school. So the listeners who've been with me from the beginning have really watched my evolution of how I've come to understand the human mind through the field of psychotherapy, psychology, and psychoanalysis. And so one of the things that I've been very passionate about is like, I want to talk about this in the simplest terms possible, right? Because exactly what you said, the theory, the ideas can bog us down and can become so intimidating And I think in the field, it then lands for many people as psychoanalysis is a thing of the past. Psychoanalysis is that thing that Freud did, didn't hasn't that been disputed by now? Hasn't research shown that that's not how it works anymore? And so my passion has been, okay, well, maybe if I can bring psychoanalysis language to the simplest denominator, then maybe it could help spread its impact. And I feel like you and I are on the same page about that.
Yeah, absolutely. I was thinking, be still my Midwestern heart. I think there's this kind of intertwine I feel between language as a barrier
Yeah.
and what kind of an exclusivity. And I think there are ways of maintaining complexity while speaking in approachable terms and livable human terms. And I think that's what people are hungry for. And there's a lot of powerful, meaning making, vitalizing um, stuff in psychoanalysis that I think people are hungry for if we can open the door.
Yeah. Yeah. Yeah, I'm curious to hear, how did you even come into the field of psychoanalysis? Like, why psychoanalysis for you?
Yeah. I think it wasn't a thought out path for me. I actually I was an English lit major, so in retrospect, as most things are, I can see the threads. I've always been interested in the human story, and I think heading to college and being in seminars that were about curiosity, that were about holding questions. One of my favorite classes was on this poetry class on the sublime,
Mhm.
holding paradoxical ideas together, like awe being awful and awesome. So all of those I've always been kind of lit up by story. But really personally, what got me into psychoanalysis was just my own need to heal. I went to an MFT program, and in the midst of that, I became an adopted. Well, I was trying to adopt my first daughter, well, my only daughter. And it was a really arduous process that opened up, um, entangled my own trauma history, my deep desire to love this kiddo, and needing to kind of understand and see her. And how that brought me into understanding my own ways and needs of loving. Um, and seeing her separate from that and I think set me on a path. So my one of my dear friends was seeing another analyst and referred me to an analyst I worked with for 15 years, and it sparked I just unfolded. There were so many corners and caverns and places in my interior I had no idea about. I
Yeah.
kind of woke up, and my first analyst said, psychoanalysis is the birthing of a mind. And I feel in a lot of ways that I was born into myself. Um, and I think a lot of times what I feel is people experience psychoanalysis either in an analytic treatment, or you bump up against someone who has done analytic work and you see how free their mind is to roam. There's a kind of spaciousness that you experience, and there's a kind of I want that.
Yes.
So that's really what set me on course. I mean, there were a lot of different experiences, but I never kind of saw myself doing depth work. So I really stumbled into it.
Yeah, yeah, that's really hear so much of myself in your story. And I think that that's how a lot of people find psychoanalytic therapists is through accidents, right? Through a referral or through bumping up or heard of somebody. I think it's rarer for people to actually seek out a psychoanalytic psychotherapist. And I've been thinking a lot about that, like what is going on there. Of course, I think there's the ways in which psychoanalysis is just not popular, and has, in some ways, I think, a bad, quote unquote, bad or challenging reputation. That in some ways I think is merited, right? Like, I think at some point, psychoanalysis kind of lost the people, and it's now become so much. so hard, I think, for people to even understand or appreciate what it is, let alone then find that
Yeah.
type of modality useful for them, unless they're just coming into it by accident.
Yeah. What's interesting about what you're saying there is Freud actually said psychoanalysis is a psychotherapy for the people.
Yeah.
And, there's a lot, there's a lot of complicated history. So I definitely don't want to glaze over. But Lou Aaron wrote a really interesting book called The Psychotherapy for the People and the radical nature of psychoanalysis history, community clinics, and what it set off to do. But I think in trying to establish psychoanalysis, what Freud got wrong was trying to tie it too much to a medical model.
Yeah.
Then we're off into knowledge, proving ourselves, right?
Yes.
And therefore the theory becomes too tightly knit to
Yeah.
provability, or
Yes.
that makes sense. Yeah.
Yes. Yeah, it's that tricky line between, like, how do we kind of show that this actually works or that there's merit, there is a foundation of theory and insight that we're built upon, while also acknowledging that so much of our work is outside of the realm of science.
Mhm.
And it's always fun and delightful when I read an article about neuroscience having just discovered, right, something that psychoanalysis has known for a
Yeah.
long time. That's always thrilling, but it also sometimes makes me feel really sad because it's like, wow, is this what it takes? Is this what's needed for some type of proving to take place in order for us to kind of trust something that it feels so intuitively right?
Mhm. Mhm. Yeah, that's right. I think about, yeah, how do you prove an unconscious, right?
That's
There
right.
there's an aspect of faith in what we do.
Yes, that's right. Which is scary, I think, for many to admit, that that's I think, the art of it,
Mhm.
right? Versus the science of it. And they're both intertwined in this field in a very, I think, complex ways that a lot of times we want to really dismiss. I'm curious for you, when I love the idea of psychoanalysis being like the birthing of a mind. I would
Mhm.
love to hear more. I'm curious, like what has psychoanalysis like meant? What does that even mean to you? When you say psychoanalytic, what is that for you?
Yeah, yeah. That's a good big question. Um, I think there are ways in which maybe I can just start from my story. Like there are ways in which my upbringing didn't really capture mind on my mind.
Mhm.
So a robust person reflecting back, my intentions and my thoughts to me. So, I think in a lot of ways, I didn't really understand what my reactions and my responses were about. I just felt them in relation to the world, in react
Yes.
to the world in a lot of ways. And I think it was kind of news to me to kind of uh think about that that my behaviors and reactions have a whole history and have a whole kind of shaping, and that with space and with connection and real intentionality that I can discover and deepen, kind of have a deeper relationship with the emotions that are underlying the depth of emotions really that are underlying, you know, all of my actions. I think that is really, I think, and that's where contemporary analysis is really a relationship.
Mhm.
That someone really tending to you helps open up that space where you can take a deeper look.
Yes.
Yeah.
Yeah, there's really nothing like having somebody spend 1 to 4, 5 hours a week just attending to your mind, and it's really remarkable how much we resist that,
Hmm.
how much we struggle sometimes to find the time for it, or In our work, meeting more times a week is a way to really deepen and intensify the treatment. And it's really interesting how often, as the patient, we feel like, oh my gosh, what am I going to talk about for 2 hours a week about myself?
Right.
What a fascinating, that's so out of the realm of what I understand,
Mm,
because I'm a chatty Cathy. I can chat
yeah.
about anything hence my podcast, right? So that kind of idea, I'm like, what do you mean? I have plenty to talk about. But I
Mm,
also do have some empathy and understanding of like how hard it can be to give ourselves time over to another person to
yeah.
just talk, you
Mm,
know?
yeah. And maybe the necessity of running out of talking about things we know. But
Yeah.
I think like there is a turn in an analytic treatment. And look, I mean, we're talking about a frequency that can feel like quite a luxury. And I think that's a tragedy of how do we make the dosage of this kind of experience available to others? It's a problem. But I think what when we can give this, we talk about it as a luxury, but it's not a luxury when we grow up. And we tend to want quick fixes for things that I think to find our way into the silent spaces within us that haven't been languaged
Yeah.
but need enough space for us to and enough bearing the anxiety to let the unknown emerge, that takes a certain kind of, a certain kind of frequency and holding to let that conversation emerge. It's a different one than we usually have. It's a different kind of intimacy than we get out in the world.
Yeah. I really like hearing this idea of realizing that maybe your reactions, your behaviors, and even your ways of thinking and feeling um, could actually stem from something more, that it could be connected to more things, and how hard that is to even think about. I'm thinking about the patients who will come to me and will try to start that process in themselves. They'll be like, I know I shouldn't have reacted that way, right? Is how it
Mhm.
tends to go. I shouldn't have. And I don't know why I did it. And I'm so bad. I can't believe I did it.
Yeah.
And how that self-loathing and that shame actually prevents the thinking, right? For
Mhm.
going more deeply into their understanding of themselves. And how that really speaks to, I think, what you're saying, which is the capacity to think about ourselves is actually a very difficult skill that most of us haven't left childhood knowing how to do.
Yeah, well, and we've left childhood with certain ways of thinking about ourselves that keep us intact. And
Mm,
why may those stories may what we know about ourselves, like the shame, I must be bad, right? The stories we repeat and come back to have their own function, even if they cause us a certain amount of suffering. And that there is a place we meet, I think, in an analytic treatment where the giving up of that story to open up space for what's possible is quite terrifying. What if I find nothing there? What if I find something worse? There can be so opening up to a deeper story is quite anxiety provoking for folks. And I like to say this is where, excitement and fear often feel the same. And learning to discern the excitement of moving deeper in, or what I like to say in psychoanalysis is offering the complexity, our client's complexity back to them,
mm,
helping them wake up to the universe within themselves, where possibility, if my story can change and my story can become more complex, then all possibilities are on the table. Right?
yes. Oh, what I love that. And I imagine that that rubs up for some people with this idea of, do I just come in and talk about myself? And why are you just sitting there listening to me? Are you going to now tell me what to do? Are you going to now um, say more than just a few sentences. I think that's a caricature in so many ways that we get as psychoanalytic psychotherapists of this idea of the blank slate. And
Mhm.
it's become such a strawman argument for every other modality,
Yeah.
of like, I'm a human in the room. I'm not a blank slate. You're going to know what I think. And I'm curious to hear more of your thoughts on that.
Yeah, I mean, as a contemporary relational analyst, it couldn't be more opposite. I mean, I think there's value in silence, but not technique. I
Yeah.
mean, I think it's cultivating a relationship that is co-created to understand moment to moment what a client's needing is spaciousness to find the words for the first time, to build the muscles to reach in, but also space to feel. Um, but on the other side, what we've learned is some people need to hear from the interior of the other. They need to know what's on my mind. I mean, I'm very active and engaged, and I come in the package that I come in. And so, some people fit with me and some people don't. But, I also shape the way I sit and be with my clients as I get to know them and what they need. And so I think that the relational component is, absolutely. I I don't really know someone who practices in a kind of default, blank slate anymore. No,
Yeah.
it definitely is a trope.
It is. Yeah. I don't also know any therapist or analyst who works that way. And so it's so interesting that I keep coming up against it in the field. And I think it really touches for so many of us of this sense of a danger in not knowing someone's mind and the fear that if we don't know what you're thinking at all times, then it must mean that there's something really bad happening.
Yeah.
And the terror of there being a space between us where you could be different than me.
Mhm, mhm, mhm. That's right. I mean, so, in essence, that the consulting room becomes, an emotional lab, in some ways to see what happens and then articulate what's needed or what's feared. And so, I think that that's where these kind of tropes, like there's one way of doing something, like silence means, withholding, or silence means, it can be terrifying for some, it can be, facilitative for others. And at different moments of treatment, it can be different things.
And what would you say to kind of the argument or the sense of like, um, well, I don't think that silence is ever helpful.
Well, I would take a posture that I think is at the heart of psychoanalysis. Well, tell me more about that.
Mhm.
Because often when somebody's coming and they're saying something definitive, and this is what psychoanalysis open up, there's reasons why they believe that. So we can come up against that, or I can learn more about the context of how you've arrived there, which might end up making a lot of sense for that person of where, you know, why I think this is so important is tied to an experience I've had,
Yeah,
which, is important to be aware of, but also being able to particularize why silence might be painful for you, but how it could change over the process, but also projecting our own stuff into the story of another of what they need.
yeah,
Other than, I think the discipline of psychoanalysis really has gotten me comfortable with just holding space, like of a not knowing. I don't know this person. I,
yeah,
I like to say to my clinicians, I don't know what's under the hood. And so I can kind of bear conversations and curiosity to come to understand, well, what does that mean to you?
right.
You're trying to tell me something in that definitive statement, and there's a lot more hanging on it than we're talking about yet.
Yeah, yeah. It reminds me, I just pulled up this quote that I just read from Ogden. And he says everything the analyst does in the first face-to-face analytic session is intended as an invitation to the patient to consider the meaning of his experience.
Yeah.
All that has been most obvious to the patient will no longer be treated as self evident. Rather, the familiar is to be wondered about, to be puzzled over, to be newly created in the analytic setting.
Mhm.
And I think that really captures what you're saying,
Mhm.
right? That we're here to kind of examine the things that we've taken for granted. Why is silence so uncomfortable for you? Or why do you feel like you really need to be told what to do in order to be fixed and healed? Why is it that you feel so angry, when you don't get your way? What is that for you? What's going on there? And as an opportunity to, instead of reacting, which is, I think, how we tend to navigate our lives, right? We react. We're constantly um, um, interacting with the environment in a kind of unconscious way, right? That
Yeah.
psychoanalytic therapy offers us a pause.
Mhm. Well, and I think as a relational analyst, you're tapping into something, which is what I want for my patients is to find agency through an understanding of what they're up to. And that
Mm,
might not even change their behavior, but it changes their relationship to understanding. Sometimes people will say, agency is being able to share my voice or to say something. But if you don't know where that's coming from and why or what's moving you, I think things open up, and we get more of ourselves back when we really can understand the tectonic plates shifting and moving underneath our behavior. Um, I think we have more choice and freedom in the world.
that's so well said. Wow, I'm really touched by that. It is, sometimes we think that agency means to be able to do the opposite. I usually shut down. So now my goal is to kind of scream it out. And I
Mhm.
think what you're saying is actually agency is the ability to choose how we respond. Maybe that is the opposite. Maybe that is the same. Maybe it is shutting down. Maybe it is scream, or maybe there's a million other options out there for us.
Mhm.
Um, and if we can understand something more of ourselves, we open up the possibility for something different.
Mhm. Yeah. Different ways of being with ourselves. Adam Phillips talks about that. I mean, it's like we're often running around the world trying to get the world to be the way we wish it would be,
Mhm.
and our behavior and actions are aligned with that, and it feels unjust, and I think I love Adam Phillips as a writer. He's just one of my favorite psychoanalytic thinkers, but it's offering ourselves different ways of being with ourselves and what we can make of reality.
Yeah.
When we know more about what our heartbreak is and what we're trying to heal within ourselves. And that then knowing from that place and bearing our longing gives us options of some things we can get. Because the truth is we can never get it back in the form that our pain is moving us to inaction.
Mhm.
Um, and so that grieving process, I think, gets us in touch with what we can have,
Mhm.
essentially. Yeah.
Yes. Yes. And how much of our work really is just the process of grieving what we didn't get
Mhm.
and
Yeah.
encountering that over and over and over again. It's not very sexy. It's not very practical. And I think we start to run into a marketing problem here.
Come to me and let's grieve.
Yeah, yeah. Come to me, let's grieve with no guarantees. And you'll probably experience more suffering.
Yeah, yeah.
You know?
Yeah, it's what did Freud say? Psychoanalysis will make you sadder but wiser.
Mm. It's such a uh, what is the word that I'm looking for? Separation or departure from the kind of field of psychotherapy, the field of psychology as we are seeing it. And it worries me. I wonder, should we split ourselves off completely in a way, right? Or of like we're comparing apples to oranges when we start to look at the ways in which psychotherapy right now seems so much more oriented towards finding solutions, finding fixes, symptom management.
Yeah.
Um, and it's when I interact with therapists who work that way, sometimes I feel like we're operating in two very different worlds. And so how jarring is it that we're actually considered the same field?
Mhm, mhm. I really hear you, and I think for years and years, I felt this resistance to the wellness community, like, or even how we talk about trauma, it's something to heal from, or these ways of trying to make ourselves whole, these words that overpromise, underdeliver, and then set a course of what we're up to, as if I think the miracle is more I like to say it's much smaller and more profound than that. And so I think that my tactic in the last few years in training and seeing clients who come in and start from a place of, okay, what's my homework? Or, I saw this on Instagram, or clinicians who want certain kind of trainings that give them tools. I like to say those are good things, in a sense of needing things to hold on to, things to put some trust in, to find self-trust. And let's talk about where those come from, or what your intention and how that serves you along the way. But trying to find a bridge somehow to I don't know, these kind of evidence-based and their place in things, and, where psychoanalysis takes off and what it adds uh, to life, and our internal landscape.
Yeah, there's a way in which I think I'm hearing you say if we're not meeting people where they're at, then we're no better. We're no we it's kind of our responsibility in a way to be thoughtful of where people are coming from and trying to meet them where they're at.
Absolutely, like that translators that starting in the language someone is speaking with. Well, I wanna be happy. Well, tell me about what happiness means. That's where I might go to poetry. Mary Oliver, we shake with joy, we shake with grief, two emotions housed under the same roof.
Mhm.
What if happiness has a more expansive experience when we can feel the multitude of feelings we have? What if happiness is in a state we try to hold on to and grab onto, but it's a place we can savor and move in and out of, but we have to have our whole emotional life, so you're moving with someone in trying to expand the meaning and possibility of what they're after.
Mhm. Yeah. So what would you say to somebody who maybe has started psychoanalytic psychotherapy and they're feeling frustrated that their therapist maybe isn't giving them the tools, the homework, you know, the kind of advice giving that they're really wanting?
Mm-hmm. Yeah, I mean, I might say I know exactly what you mean. In some ways it is frustrating, and I think part of why I'm here with you bearing that frustration is I have my own experience and the experience with clients of trusting there's a wisdom inside there. There there is a voice that's trying to emerge. There's emotional experience that we only can witness if we're patient, and stories to be told. And so frustration is a productive thing. It's like Adam Phillips talks about boredom being kind of having an agita, like having a edge of frustration. And we think of creativity as what happens spontaneously out of these moments. And I think that's part of the creative process of being able to bear the unknown and the frustration, and having faith that something more will show up.
Yes. And I think the coolest part about the way in which we work is that we welcome the frustration, or we welcome the feelings of I don't know that this is working, or I'm mad at you.
Mhm.
in a way that can actually tells us that something about the treatment is working. You
Mhm.
know, I know that it can be so terrifying for us to say to our therapist, "I'm mad at you. I didn't like that you said that. I felt really dropped. You know,
Yeah.
I feel like you're missing me. You're not listening to me."
Yeah.
It can feel like what we're essentially doing is terminating the work,
Mhm.
which uh, is actually, if you're working with a therapist who has kind of any insight into the actual potency of these expressions, what you'll actually find is that that's when the treatment really starts.
Absolutely. I mean, to think about, I don't know how many clients who, after telling me there are many ways I've disappointed them, and there are a multitude, right? That they come back and say, I feel more vitalized or I feel closer to you, you know? The sense of being able to, I think that's also the difference of our work is it's not just insight, um, but it's experiential. And so when someone can tell you, I'm mad or I'm disappointed, and we can hear that. And sometimes that might mean saying, you're right. I think you're picking up on something in me, or I think I did that. Or it might mean, I'm hearing that and I really have compassion for how you feel and I have some thoughts on it as a separate human, right? But that we can go toe to toe and the thickness of our relationship stays intact.
Yes.
So I can know you and you can know me, and that there's enough here. That has to be lived through,
Yeah.
particularly for people who've experienced a trauma where there's a lot of brittleness or breakage. You know, that's the only way through. You can't go under it, you can't go over it, you gotta go through it.
Yes. Yeah, I think it's the same article that I quoted Ogden, that he talks about how we can't really explain the analytic process. It's an embodied experience, and we can support our clients in that embodied experience by how we hold them in the first point of contact, in the
Mhm.
first session. The moment there is an engagement together, we are in an analytic process together. And I can, on the one hand, appreciate that, and I know what he's referring to, having been in my own analysis, right? Through my own embodied experience, I know what that means. And on the other hand, I get very annoyed by that idea.
Sure.
It doesn't then help me sometimes, in those moments with the client who is actually wanting me to articulate it or is trying to say, well, what is going on here? What are we really doing here? And sometimes, what I want to say is just keep going. Like, you know what? Put aside that question for a year. Let's just keep talking and then we'll
That's
see, you know?
right.
And that's not a very satisfying answer.
Yeah, that's right. That's right. I mean, it's I think you have two things. One, how metaphors sometimes can help us hold those places and learning some kind of descriptive process that, main it's not going to assuage all the anxiety, but it might give a picture like diving, when you're practicing diving, you don't go all the way to the bottom. You come down, you come up, and it's quite boring. And until you've developed a capacity to really go into some of the places that open up experience, right?
Yeah.
I also think about in training clinicians the parallel process. And I think what's different about the way I've situated our training program, but most analytic postured programs, which is it's a parallel process of experience. So in the supervision, I'm asking my clinicians to struggle with all the feelings that are brought up for them and helping them stay with that to see what emerges. So that there's something about developing a non-anxious stance to the unknown that speaks more than any words you can say to a patient.
Yes.
The longer I've been doing this and there's just a kind of faith that I hear you, it's hard and let's keep holding that. Maybe this isn't the right treatment. My
Yes.
experiences as we walk it out, and I mean that like that. I try to be open. I don't know the answers for my clients, and my patients. But if I can with an open heart and an open hand, try to be alongside and share the best of what I know, but with a healthy humility and respect for what I can't know is right for them.
Yeah.
All of that creates a container of trust and space that ultimately all of this is to help them know their own mind and selves. So that kind of respect is felt, and I think gives people a faith to keep going.
Yeah.
So,
Yes. I find that the sturdiness of the therapist will dictate the treatment, and
mhm.
how best for us to find our own sturdiness by struggling with our own mind and our own thoughts and feelings. That's where, when I heard listen to your story, I was like, wow, you too, because I also experienced a few therapists in my grad program, a few professors who had a sturdiness of mind that I was like, I don't know what you've done to yourself. Whatever it is, I'm sold. Whatever you've done that has created such a presence of listening and ability to tolerate people's doing all sorts of things, that's what I wanna develop in myself, and then when I look to see what's the common denominator with all these, professors, it's psychoanalysis, and that's why I then quickly drank the Kool-Aid. I was like, "This is I'm sold, I'm bought, I'm in." Because especially out of my own trauma and my own chaotic childhood, the idea that I could do something that could help me feel sturdy in myself felt like a siren's call.
Yeah. And in fact, the way through is not to like when you come to point of understanding that vulnerability and being able to move into it and hold it as part of your story to bear it
Yeah.
becomes your greatest gift. Like I'm not afraid of, you know, the effects of my childhood or the ways that it used to splinter my mind, fragment me. I've been through that process. Like I've been through an analysis that left me wondering if I could find my mind on the other side. But walking through that, I think gives you what you're talking about, a sturdiness and a faith in this work.
Yeah, yeah. I love that. And I have this fantasy that you are a woman on a mission. I've been seeing you grow your group practice, and I saw your rebrand. I've been an admirer from afar of the beauty of your new physical space. And I would love to hear a little bit more about the Alamo and what your dreams are for that space and for yourself.
Yeah, well, thank you for asking. Yeah, it's been a dream. So I, um, have been running a group practice for about 15 years, but during COVID, the opportunity to buy this historic building in Highland Park came about, and the building is named the Alamo. People ask, why would you name your psychotherapy practice the Alamo? Because the Alamo is a conflictual point in history and name, and I'm very aware of that. But that what's interesting about this building is it's been there for about 100 years, and the neighborhood the footprint of it was built around the Alamo itself, so it has kind of reminiscent. And as we renovated the space with the idea of not just training clinicians, but bringing a community together of people to do high quality training with psychoanalytic thought and connection and community on the east side of LA, I thought how much more potent than having a building with a history, a complicated history that we make use of.
Mm.
That's psychoanalysis.
Mhm.
It's how do we make use of what has been and open up possibilities for a new. And there's a continuity in holding all of that together. So I'm really inspired by the space. All that to say,
Yeah.
I think the vision for, we have a big space that we can host 100 people for training. So we're just really trying to make psychoanalysis more accessible at early points in training and help people get a taste of the specialness of what you and I are talking about and really lower the barrier of accessibility through, you know, lower fee trainings and also a more human language approach, and letting clinicians encounter all types of analysts. Mm, Yeah.
I love that. What a mission. Um, and how exciting for you. I'm very, very um I'm a big supporter and I really can't wait to see how it continues to grow. I mean, I saw that you're hosting Gpala conference. I mean, it sounds like this space is going to be such a hub of community
Mhm.
and it really touches me because I know how important in-person community is, and even in a post-COVID world, we need spaces to come together.
Yep. Yep. Absolutely. And I think we need community to do this work, to be authentic, vulnerable practitioners who bring our humanness in. That's an ongoing way of keeping ourselves nimble and open. We
Yeah.
need each other.
Yes.
Um, yeah.
Yeah, I moved from LA to the Central Coast a little over a year ago, so I'm in San Luis Obispo now and have been creating the San Luis Obispo Psychoanalytic Society, SLOPS, if you will. And when we've been thinking about events and things to do, I've been taking a lot of inspiration in the things that you've been doing.
Yeah.
And all that to say is that, you are planting seeds all over, I'm sure all over the world, but certainly in Central Coast. And so I'm really appreciative of that.
Well, thank you. That is a huge compliment.
Yeah. All right. Well, any final comments, notes before we wrap up?
Well, um,
You want people to know? Big question.
um, that is a big question. Just keep, every space is for you. I think if you're intimidated, just if clinicians listening, step into psychoanalytic spaces. They're for you as much as anybody else. And come join us at the Alamo. We're always putting on trainings and courses, and we have online and in person. So all are welcome there. And I just hope people fall in love. What has been to me, it's not a profession, it's a posture of life. It's a way of being in the world, and I hope it continues to catch. And thank you for this project you're doing as well to spread the good word.
Doing what I can, doing what I can. Thank you so much, Michelle. I really appreciate your time and your thoughts. You've given me so many good things to think about, and I'm really looking forward to getting this episode out into the world. So thank you.
Thank you.